Hello and welcome to today's webinar, Enhancing Patient Outcomes and Increasing Revenue with Z-Wave. This webinar is presented by Zimmer MedizinSystems Aesthetic Division. I'm Regina West and I'll be moderating the webinar today. At any point during the presentation and Q&A, you may submit questions by typing them in the Questions tab on your webinar control panel. Following the presentation, we'll cover those questions live. If there's not enough time remaining for all of the Q&A, answers to your questions will be emailed to you. And now I'd like to introduce the speakers for today's webinar. We have Drs. Anna and Brian Buinewicz, the husband and wife founders of Buinewicz Cosmetic Surgery and Med Spa. They're standing by. Let's bring them on camera now. Drs. Buinewicz, would you please join us? Hello, Dr. Anna Buinewicz, Dr. Brian Buinewicz. How are you?
Good evening.
Okay, if you'll, thank you again for joining us. If you'll stand by for just a moment, I will get into your bios here, and then we'll hand the presentation off to you. With over 25 years of medical experience, Dr. Anna Buinewicz brings a wealth of knowledge to her cosmetic practice. She's a board-certified family medicine physician, graduating from Jefferson Medical College. Dr. Buinewicz has been on staff at Abington Memorial Hospital since 1989 and has served as the medical director for health and wellness at Merck & Co. for 14 years. She specializes in non-surgical procedures such as laser treatments, injectables, and non-invasive skin tightening and fat reduction techniques. Dr. Brian Buinewicz is a board-certified plastic surgeon, serving as the Emeritus Chief of Plastic Surgery at Abington Hospital. Additionally, he holds the position of clinical instructor at Temple University Plastic Surgery Division School of Medicine and Surgery. He co-founded the Wound Healing Center at Abington Memorial Hospital and served as Associate Medical Director for Praxis Clinical Services. He's an active member of esteemed professional societies, including ASPS, ASAPS, Northeastern Society of Plastic Surgeons, Ivy Society, and the American College of Surgeons. He has presented at multiple society meetings, sharing his valuable knowledge with his peers and colleagues. So again, if you're just joining us, I've introduced Drs. Anna and Brian Buinewicz, who will be speaking on enhancing patient outcomes and increasing revenue with Z-Wave. Welcome again, Drs. Anna and Brian Buinewicz. Thank you, and I will hand the control of the webinar over to you in just a moment, and we should be able to see your presentation. Okay. We see your PowerPoint, and I will leave it to you.
Okay, so I want to thank everybody for joining this webinar tonight, or the afternoon if you're in the central zone, or I guess the western zone. The Z-Wave device has been amazing in our practice, and what we're going to do is discuss the multiple uses that we have in the practice. So this is the device. The original Z-Wave Pro is what we initially used for several years. It was a little loud, and now we have the Z-Wave Q, which is a cooling system. It has a cooling system in it, and it allows a much more efficient treatment. The hand pieces do not get warm, and actually you can treat a patient with just using one hand piece. We used to have to alternate the hand pieces, so it actually took a little bit more time, and therefore it's much more efficient just from a patient scheduling, a time in their visit.
Most importantly, too, it is so much quieter than the other machine.
And definitely much quieter. Talking about the Z-Wave, which is basically acoustic sound wave, or what other, advertisements are shockwave therapy, and shockwave therapy is big. We'll talk about erectile dysfunction in male patients later on in the discussion. but you probably hear these key, names in radio and even on TV. But basically, it is a mechanical generation of sound waves into tissue, into soft tissue. It is definitely not to be confused with ultrasound techniques that create heat. It's basically just penetration of sound waves radially. If we all, and obviously we've been in practice a long time, but when we were in medical school and even prior to our medical education, lithotripsy for basically decreasing or trying to break up renal stones. So that's where this extracorporeal shock wave or acoustic sound wave therapy came about. Indications have evolved. It is definitely facilitates clearing swelling or edema, damage to tissues. It does improve lymphatic drainage, and we can see over time with repeated use. We will talk about cellulite reduction and enhancing postoperative patient recovery. The creation of collagenesis and increasing arterial blood flow, increasing capillary generation in these areas devoided of blood flow. It is definitely an instrument now that has been FDA cleared for cellulite, and we have been very successful treating our patients with the indication for cellulite. We treat post-cool sculpting. Recovery is much quicker for cellulite, and again for sexual medical indications. And then we're just, going to talk about reported uses. Again, edema, I don't want to duplicate, but edema, scarring, trauma secondary to surgical procedures. We've been very happy with our breast surgery patients that develop capsular contractures, breaking up fat cells after Meridry treatments, post-laser. We've been successful with enhancing and expediting recovery and reduction of tattoos after our laser treatments, and any other cosmetic procedures that we feel it is appropriate. This is what the handpiece looks like, and again, we will talk about the science behind it. The acoustic sound wave is spread radially. A lot of the previous type acoustic devices were linear, so this allows to treat a larger area and have deeper penetration into the soft tissue. And again, another view of the instrument. Again, as Dr. Brian actually alluded to, soft meaning it's quiet. The difference advancing to the newer Zimmer Q is beneficial to not only the patient but to the provider, because the previous device was a little bit noisier, so it's much more pleasant for the patient experience. Just comparing old versus new, the old acoustic treatments were more pneumatic versus the electromagnetic technology.
So if you go back for 1 second, if you could.
Absolutely.
So when you look at, these are the pistons. Think of it like sort of a rifle, and you're firing a bullet. The one on the right-hand side is a much larger piston. The one on the left-hand side was the original piston used in the pneumatic devices. And if you think back to Einstein, where force or energy is equal to mass times the velocity of acceleration. So if you have a tiny little piston like the left one, you got to get that thing firing very fast to get the same amount of energy delivered. With the much bigger piston, it's a lot less energy movement of that device to generate the same amount of energy. And we have one of the original pneumatic devices for years, and started using that on Cellulite. It was an incredibly noisy machine. There was user fatigue with that because of the vibration for the pneumatic device. But even most importantly, with all of that extra energy, driving that piston much faster, there was a lot of mechanical failure. We used to have to go back and replace the pistons. You'd have to change the treatment heads. We don't see that by far with the newer Zimmer machines with the electromagnetic way of driving that piston back and forth.
So how do we use our Zimmer devices? We have Zimmer devices in both locations. We have 2 different locations, and they are used constantly in both of our offices. Again, post-cool sculpting, the patients say that the recovery is significant. There is less numbness after cool sculpting with the use of the Zimmer, and it's much more comfortable even for the provider with the post-massage that's required. Again, Cellulite recovery after plastic surgery procedures. Dr. Brian's going to talk about his capsular contracture patients in a bit. Sexual medicine, both for male and female patients, and again, accelerated tattoo clearance of pigmentation. So with regard to post-cool sculpting, again, more consistent outcome. Again, it's an easier recovery. Patients have less numbness. The use of the Zimmer is much more professional than manually massaging the area, and again, much more aggressive than manual. There's no way that you could equate, a human manual massage versus the Zimmer.
If you've ever had Cool Sculpt done, and I had it done when we got our machine, that manual massage, this is before we had the Zimmer, it hurts. I mean, it's not a comfortable thing by far. And using the Zimmer, you significantly decrease the amount of patient discomfort they have after treatment.
Yeah, and also the edema that occurs after cool sculpting, significantly less. And again, that's how we enhance the speed of recovery and improve outcomes with regard to their results. So this is just to talk specifically. The way that we actually manually maneuver the handpiece is key in optimizing results. And that's something that, comes with experience, and also, we can certainly share our recommendations and protocols. Again, for Cellulite, which significant changes. And again, as Dr. Brian spoke about, we have been treating Cellulite for over a decade with acoustic sound wave. Previously, it was the Cellupulse machine, and again, very uncomfortable, painful, and now the Zimmer, very calm, quiet, and a very comfortable, almost like a massage feel. And each treatment typically takes about 15-20 minutes, and these are the actual protocols that we stand by, the amount of pulses and how much area should be covered with how many pulses and what energy levels.
So again, too, one thing we're learning with all this, the machine really, there's no risk at all to treating somebody. It's a comfortable treatment. More is better. So if you're starting to see results and changes with 3,000 pulses, there's no reason not to keep doing more pulses to, get the result that you want with this machine.
And you can, to that note, you can continuously treat. There's no end point. I mean, the more you treat, the more sessions, the better the outcomes. And we've treated some patients, specifically one that we'll talk about with capsular contracture. I think I did 20 plus treatments on her, and she ended up not having to be a second surgery. So treatment effects with cellulite, how does it work? Basically, it increases blood flow, basically caused by the massage or the pressure that is, penetrated into the soft tissue, creating vasodilation. So that's short term, but long term, we are also seeing formation of new blood vessels. And again, in any area void of blood flow, specifically even obviously with the cellulite and the stria, that create that puckering appearance to the skin. Again, lymphatic drainage, we spoke about that, obviously as much massage as possible, reducing edema, getting ridding of the toxins and triglycerides in the area that we're trying to treat. Mechanical and biochemical lipolysis, and again, the relaxation of the fibrotic structures, and again, that's more specific to the puckering appearance of cellulite. And obviously, we want to strengthen the connective tissue leads and improve elasticity and formation of collagen.
If you think about this, the whole treatment idea, it's barotrauma. There's all levels of barotrauma. So if you go back to the old-fashioned Turner Classic Movies and World War II, where boats are throwing death charges into the ocean to blow up submarines or to just disable them, same exact idea. You're getting that radial shockwave therapy going out three-dimensionally, and that sound travels through the tissue and the medium faster than that medium and tissue can respond. And that's where you get your damage and injury. So you're cracking the hull of a submarine when, the shockwave therapy, the Zimmer therapy hits cells and all, you're, going through the cytoplasmic cells, there's, damage that's done there. And what those cells will start to do is that they'll start to upregulate and they'll start releasing, growth factors like VEGF and, epidermal growth factor, fibroblast growth factor. And that's where you see this, growth of blood vessels and improvement in lymphatics happen with all this. Plus you are getting the mechanical barotrauma effect of, driving fluid out of the tissues too. So it works in different ways. And when you try the machine out, especially with the Zimmer Q, and you put it on yourself and feel, you're like, that can't be working, because you're really not feeling that much because of the technology behind the machine, but the energy is still getting delivered.
So these are studies that were performed by Dr. Naranjo from Spain, and interestingly, in his evaluations of blood flow in cellulitic areas, you can see that there is such poor circulation in the superior frame that we're looking at, figure 5. But after 10 treatments, and that's usually the protocol with the Zimmer, a series of 10 treatments, potentially 2, maybe 3 times a week, you are seeing significant arterial blood flow in figure 6. And again, other things that we spoke about earlier, we're talking about superiorly in this slide, collagen synthesis and smoothing of the surface of the tissue of the skin.
So I mean, you're seeing, the edema driving out of those little cellular pockets of fat for cellulite, where that's going out of the tissue. You're also seeing those fibrocepta, which contract down, that you're modifying them. They're changing, and you're getting new collagen deposition, hopefully stretching them. So that's sort of what you're seeing on that ultrasound picture there.
These are just before and after pictures that we wanted to share with you. You can see the dimpling in the left slide of the patient, and after our 10 treatments, a few months later, and we typically tell our patients to wait 3 months for full effect, but significant changes. Again, similar, especially the superior aspect of the thigh just below the gluteal curve. This is a picture of one of our patients. We were trying to we were experimenting with skin tightening. You know, we have other devices for skin tightening, but with the Zimmer, we actually, I feel, had a significant effect. She had cellulite, but also laxity of her skin, especially up above the knee. So the patient was very happy with this result. She's an elderly woman. Again, before and afters, and this is only after 6 treatments with the Zimmer, the smoothing of both the buttock and thigh. And every patient is different. You know, some you see changes after 2 or 3 treatments. Some, you know, it's like 6 or 8, and then all of a sudden, you know, the patients are, you know, becoming very happy. And that's just a closer look. But you can see the power, you know, of this treatment. Now, this is a patient of ours that we treated. She was insistent. She had had surgery, spinal surgery. She went ahead and had tattoo placement to cover her scar. And then as she, you know, aged, she felt that it was, you know, the tattoo was inappropriate. So she came to us to remove it. And then we have the PicoSure laser. After 4 treatments, it was not fading as quickly as we wanted. So then I decided that I would try, because of the edema that is produced by the Pico laser, to follow it immediately with the Zimmer for the following 6 treatments. And after 10 treatments, you really can't see that tattoo anymore. So the use of post-surgical treatments with the Zimmer, you know, liposuction, I think I'm going to turn this over to Dr. B so he can talk about the surgery aspect and capsular contracture uses that we've developed in our practice.
So again, thank you. The one thing with the Zimmer is we probably don't use it enough in the practice. I mean, I wish we had extra machines, extra time to use this, because any operation where you're altering the blood supply, lymphatic supply of tissues, liposuction, tummy tucks, thigh lifts, brachioplasties, there's always going to be edema afterwards. And typically what we did, what we were taught, is you have static control of the edema with compression garments. You try to get the patients to massage the areas out. It works, it's slow. The Zimmer definitely accelerates all that. So we've been basically bundling this into our packages for abdominoplasties or liposuction patients, that they get Zimmer treatments after the procedure in order to help aid the recovery. But also, I mean, there's always those patients that have persistent edema, where the swelling's not going away. And now you have an unhappy patient that's coming back, and instead of telling them it takes time, you need to keep massaging, now you can add in another treatment modality where you're proactively helping the patient, and you're definitely going to speed up the recovery. So any surgical procedure that I can use this on, we do. Initially with the pneumatic devices, the more uncomfortable devices, you had to wait a while until they were comfortable enough that they could tolerate that shock therapy. Now with the Zimmer Q, it is much more comfortable. You can start treatments within a couple weeks afterwards. So I try to use it on most of my body contouring procedures when I can, definitely with the ones that have delayed healing and delayed edema. We then transitioned into treating capsular contractures. I mean, obviously it's an off-label use for using this on, around an implant, but again, you have another set of patients, in even early after an augmentation or reconstruction, where they start tightening up, and you're having the patient massage and it's not improving. With acute onset capsular contractures, delayed onset capsular contractures months afterwards, we see a significant improvement with the Zimmer. You can save patients having to go back to the operating room to treat the capsular contracture. It does take a lot of treatments. It takes a lot of tender loving care. Annie will go into that because she winds up usually doing most of these procedures on my patients, but you can be talking 10, 20, 30 treatments in order to get the results that you want. But is it worth it? Absolutely, if you can save the patient an operation.
So yeah, so we do use it, post liposuction patients, and a lot of liposuction patients aren't very compliant. Abdominoplasty patients, just for the edema, especially in the lower abdominal area, sort of gets pockets of edema down there. Brachioplasties, and this is one of Dr. B's patients. And you have the history. This patient actually, prior to coming to our practice, had breast augmentation.
Yeah, she'd had breast augmentation, bad capsular contractures. Saw her. I recommended for surgery to have total, complete capsulectomies, removal of the capsule in its entirety. And she wanted new implants put in, so we put new implants in and wound up having a capsular contracture again afterwards. And it was her, first operation with me. 2 total operations. She was not looking forward to a 3rd operation, so we started with the shockwave therapy treatment for her breast. And Andy can go into how many treatments, but it took several treatments. A lot of times we'll treat them for a session of 10 treatments or so, give them a month or so break, see them back, and if we need to start therapy again, we will. So you can go into more as to how many treatments for this one.
Yeah, so so this patient, she did have a significant contracture, and we initially did six treatments, and she started to really soften. She still, her implant was still very high anatomically, but she was insistent on not undergoing surgery. She is not only a breast patient of ours, but she does other cosmetics, so we know her very well. And she lives very close to the practices, to the sites. So she elected to continue to try, more treatments. And I think it was 20 treatments with this patient, where all, slowly the capsule got softer and softer, and then basically fell right into place. And she's perfectly symmetric, and she has been, that was 3 years ago. She still says that and we've evaluated her post 2020, and she still remains symmetric.
I see all my patients back forever, so I mean she still has no capsular contracture. They're equal on both sides. Can you briefly touch on what your protocol is for that? Number of pulses and settings?
Yeah, so initially I was treating, I do 2 depths, 2 different settings now. I treat typically each breast, probably 4,000 to 6,000 pulses at a treatment, which doesn't, it sounds like I should be in the exam room for an hour, but it literally is about 10 minutes. So again, that frees up any provider or your extenders. I mean, it's not a very long treatment, and it's well worth it, obviously, since this patient's been very happy for many years with us. But we have 2 different settings. One is at the 120 joules per meter squared energy and 16 hertz. And then I flip back to 90 and then a 15 hertz setting. So superficial, deep. Again, I'm going to show you a video of how we actually perform that treatment. But these are, before we get to the video, this is another patient of ours. She had a capsular contracture of her left breast, and on the side view, you can actually see that the left breast has dropped. And that was only after, I think, 6 treatments with the Zimmer. So there we go. So we're going to show you a video, and this is how so it's not very loud. areas of scarring at the inferior aspects of the breast. We treat all the way around, hoping that we can soften the capsule so that that implant drops into the correct anatomic position.
Dr. Buinewicz, that may be a little difficult for us to hear the
Oh, sure.
audio. If you could just summarize
Sure.
what you're saying
Yeah.
in the video.
Yeah, so yeah, absolutely, Regina. So what I'm actually doing is I do like to treat the entire breast, the entire scar, whether it's a superior thickened scar, but I do believe that the entire breast should be treated, and angling. You can feel the tension with the scar, so we're angling that handpiece so that it can reach the that tissue that we really want to target. So
Yeah,
that's
it's important too, like you saw, like the pressure that's applied, the angling. There's definitely a learning curve. It's not a huge one, but it's a learning curve as to how you hold and angle the handpiece to get the energy going right basically where you want it to go.
Yeah, and what we do, I typically will do the first 2 or 3 treatments with one of our staff members. Our staff members, whether they're medical assistants or nurses, they've been trained, but they need to do the treatment, exactly the way I do it, or Dr. B does it. Yeah, there's the pressure technique, and the angling is the most important. So we've touched on cellulite, we've touched on capsular contracture, post-cool sculpting, and now in the new arena is sexual medicine. We were fortunate about 10 years ago to train with a group of physicians. Their name is, the Gainswave, corporation. And it was fortunate because we had we had obtained the Zimmer for cellulite and for post-surgical patients, but all of a sudden, there was this phenomenon that if we can create new blood flow to scar tissue and cellulite, how can we maybe assist in male erectile dysfunction? And you hear this in the radio ads and TV ads now, but in our experience treating male and female patients, the satisfaction is over 85% with a very non-invasive, very quick treatment, obviously a series, but the Zimmer specifically for male patients, treating the pelvic floor where the entrance to the main arteries evolve, and actually treating the penile tissue, it does increase the blood flow. There have been studies with increased angiogenesis, decreasing scar tissue, specifically Peyronie's disease, where the patient has severe scarring and severe curvature. We've been very successful treating, with these benign treatments. And again, now the new wave is now what we call FemiWave, which is treating with the same tool, the same device, but intravaginally and externally. So science evolves. We all know that. Botox for cosmetic. Now we have Botox. We have indications of 50 or 50 plus for that medication. So we're going to just summarize. So short-term and long-term, results, obviously increasing collagen, increasing blood flow, reducing edema, exciting for post-operative patients, a series, obviously series of treatments is much more effective. Patients aren't going to, see significant changes after, 1 or 2 treatments. But the collagen formation, reduction in the appearance of cellulite without any injections. Obviously we had Quo on the market previously, but without hyperpigmentation, you need to the pros and cons of injectables, for cellulite with hyperpigmentation. There is absolutely there are no side effects to the Zimmer. There no downtime, and it's absolutely the most comfortable treatment that we have in our office. Most importantly, you can delegate to your extenders in your office. You just have to train them, and it's like any treatment in a medical facility. You have to have the right protocol and the appropriate training. Return on investment. This is one of the most exciting tools that we've had in our practice. It's one of the least expensive investments. There are no disposables where you obviously, whoever's had, lasers in their office or any other type of non-invasive devices. I mean, there's always disposable costs per patient. And even with the Zimmer, the warranty is, annual or every 2-year discount. It's amazing. We do talk about pricing. We can certainly, give you a little bit of input. With sexual dysfunction, the average cost that is quoted by the Gainswave company, which we were trained and certified, so we abide by their pricing. 6 treatments, and you're talking maybe 20 minutes a treatment once weekly at this point for that indication. We charge $3,000. The investment, and I don't want to be, I'm not exact, but I don't think that the Zimmer is much more than $40,000. And if you think of, charging a patient for 6 treatments, 20 minutes, and it's only $3,000, it's an income of $3,000 per patient. For cellulite, I do treat a series of 10 treatments, and our cost is $1,800. And for capsular contracture, it depends on Dr. B and his patient, and the capsular contracture. Sometimes if it's indicated, we will provide 4 treatments at no cost to our patients. If they require additional treatments, then we will actually provide them with a package of 6 treatments for $1,200. And most patients, after they see the change after a 4 treatment period of their capsular contracture, they are absolutely on board. I hope this presentation was of interest, and that you have learned additional uses of the Zimmer and acoustic sound wave technology. And in conclusion, this is in conclusion, so I'm going to turn this over to Regina.
Oh, thank you so much. Thank you for that wonderful presentation. Really a lot of information there, and you brought some wonderful visuals to go along with it. I just wanted to also let we may have lost Dr. Anna. You can come on back anytime, Dr. Anna. We're about to start the Q&A portion. But I just did want to mention, hi, Dr. Anna. I just did want to mention to our attendees that the capsular contracture patient that Dr. Anna shared in her presentation, all of the details of that are available in a case study. She prepared a white paper, and that's available on the Zimmer MedizinSystems website if you want all of the details, protocol, settings. So you can access that anytime. Now I will take the screen back and we'll be able to start the Q&A. Okay, so there are several questions coming in here. One of them, let's get right here. I did write down the pricing that you went over, Dr. Buinewicz. One of the questions is, did you say $1,800 for 10 sessions for cellulite? I think you said 10 treatments, $1,800 for cellulite. So that would be correct, yeah? Oh, your mic, you may need to turn your mic on, Dr. Anna.
There you go.
Yeah.
Yeah, so with the cellulite, you know, it doesn't sound like a huge amount of money, but, you know, after 1 or 2 treatments, we do delegate to our medical staff, and they actually do the treatment. So, and it makes our patients happy. They come in for, obviously come in for other procedures.
Wonderful. So I just wanted to also remind the attendees you can continue to submit questions as we go here. Another question, how many sessions are there in the treatment series for ED and for cellulite? I believe you did also go over that. Can you review?
Yeah, so the treatment protocol for erectile dysfunction, 6 treatments once weekly. About a decade ago, we were actually treating twice weekly, and the studies that were going on, the effectiveness was equivalent whether you treated once weekly or twice weekly. We still created that angiogenesis formation of arteries, and it's more realistic for our patients. Obviously, most are professional and obviously can't get to the office, you know, twice a week.
Mm-hmm.
For cellulite, that is different. We do like to have our patients come in if they can, twice a week. You know, it's a cumulative treatment, breaking down that stria, that scarring, the bands that have occurred, and reducing, you know, the edema.
Can you clarify with the cellulite? Because I mean, if you have somebody come in that has cellulite of the buttocks, posterior thighs, anterior thighs, medial thighs, are you charging per area? You're charging for everything?
Yeah. So what we pretty much have mapped out is a maybe 3-inch by 6-inch area is a treatment area. Yep.
And you mentioned you try to get them to the patients to come about twice a week if they can. Now, what if they can't? How does that affect their results?
So they still get results. It's just extended. You know, the goal, their target. You know, it just takes a longer period of time.
Okay, great. How long is the shockwave treatment for ED?
So I did cover that. So it typically takes about 20 minutes. By the time the patient comes in, they, you know, obviously get gowned, you know, literally our treatment time is maybe 15-20 minutes. It's very quick.
We may bounce around a little bit here. We're going to go to the tattoo treatment, the accelerated tattoo clearance. A question about that, but we may very well come back to capsular contraction and contracture and ED. How long after tattoo treatments do you treat?
So initially we were having our patients come back a day later, and at a more of a gentle setting. I actually will treat the patient, and I will actually do the Zimmer right afterward.
Okay.
Right after the treatment.
Right after the treatment and a day, did I understand correctly? And then a day later?
No. Initially, we were waiting a day, 24 hours later. But I have a sort of a protocol where we can actually, the PicoSure is relatively comfortable. As you're having the treatment done, it's very uncomfortable. we actually topically anesthetize the area, and therefore it is comfortable enough for the patient, adequate and anesthesia to the area where we can actually do the Zimmer at the time of the laser treatment.
Okay. And regarding your protocol and your settings, is it, and I assume that this refers to the Z-Wave Q versus the Z-Wave Pro. Do you use the same settings for both devices?
We actually were using both the same settings with both devices. Yes.
Mm-hmm.
It's just that with the Q, the handpieces don't get, it used to be because it wasn't a cooled system, the handpieces would get hot and then they'd shut off. And we'd have to alternate back and forth with, there were obviously two handpieces to the device.
Mm-hmm.
And with the newer device, the Q, we don't have that issue at all. And we can actually treat like the whole treatment session with one handpiece. So it's just much more effective from a office scheduling perspective, much quicker.
Okay. Dr. Brian, I'm going to address this one to you. There's a question. No tips and replacing the piston periodically like the old bullet that you were speaking of, the difference between?
We've had the Q now for how long, Annie? 2 years, 3 years, or longer?
Probably 3 years.
I don't remember you ever telling me that had to be replaced yet.
No, so I think it's probably, I'd have to double check with obviously the Zimmer, representative, but I believe you can get over 100,000 pulses before there's a specific medical tip that does slowly wear down, but it's hundreds of thousands of pulses later. And we rarely have, I think it may be every 6 or 8 months that we replace that. We go through, we treat, I have to say, probably 25 Zimmer patients a week between
Wow.
your post-surgical and my patients and my Gainsway patients, the sexual dysfunction.
Mm-hmm.
So we we use that, the Zimmers at both offices. That's constant.
Yeah, and you're really getting that ROI with 25 patients a week.
Absolutely.
Yeah, okay. So let's jump back to ED for just a moment. A couple of questions here. How long do results last? And also, how effective do you feel the ED treatments are?
So in our experience, you're talking about a spectrum of the age, like it's a bell-shaped curve. So, my youngest erectile dysfunction patient with Gainswave was 28. It was more of a psychological dilemma that he had. He had a abusive significant other. And with that individual, it was more giving him a crutch to become mentally healthy and having a healthy sexual relationship with a new significant other. My oldest patient, I have to say, was 89. And we are seeing more of the, I'll tell you, more of the 70 to mid 80 range men, coming in.
Uh-huh.
But overall, I have to say between 85% to 90% satisfaction rate with our treatment.
So if you have a patient that has a successful outcome and is happy, what is your maintenance protocol? When do they usually come back for a maintenance treatment, or do they, or?
Yeah, we've actually. So the longevity. So you Virginia, we were talking about the longevity of the treatments.
Yes.
The studies show out to 2 to 3 years. We have patients that come back maybe a year later. I've had patients come back 2 years later. It just depends on the patient. And it also depends on their comorbidities. The 15% that were somewhat happy but not ecstatic with their results had major comorbidities, cardiac disease, diabetes, cholesterol, you know, the whole gamut. But again, you know, they want to have a normal, healthy relationship. They want to have a healthy sexual, you know, life. So the beauty of this treatment is that those patients that may be at risk for a surgical procedure, whatever penile implant or even diabetics that have, you know, potentially been recommended or maybe on the edge for injectables for erectile dysfunction, you know, the issues with secondary bacterial infection, obviously, it's a needle stick, to high risk for surgery, you know, patients that are cardiac patients, you know, you have to weigh the pros and the cons. And if you have a tool like this, that there's absolutely no true side effect, I mean, why not offer that to your patients? And we actually, in our office, I mean, I think we're probably 35 to 40% male population in our, you know, in our practice from the cosmetic perspective. And a lot of those male patients are very, very happy that we can offer this to them, that they don't have to go to a you know, a clinic that's advertising on the radio. They, you know, they come right here.
Yeah.
And correct me if I'm wrong, there's very few patients that you're also doing PRP injections with, correct?
Yeah, I mean, we do PRP injections, penile, you know, the P shot, you know, if we need to. I have to say, in all the years that we've been treating erectile dysfunction, it's probably maybe 10 patients out of the hundreds that we've treated. And again, you know, I always offer this is a tool that's non-invasive. There's no risk for infection. There's no risk for a hematoma, especially in a, you know, an organ that is, you know, almost like you could get a compartment syndrome. You know, you could cut you know, the blood supply. So, you know, why not offer this to them? And it's such a high satisfaction rate. You know, I mean, they say it's too good to be true. When they start the treatment, I actually had the one gentleman up in our New Jersey office, and he said, "I'm going to trust you for the first 2. I'm only going to pay for 2. And after 2, if I see some changes, I'll do the rest." And he is so happy. He's a 60-year-old male, happily married, you know, obviously with erectile dysfunction. You know, it starts in their, you know, the men start with erectile dysfunction in their 40s. It escalates 10% per year, per decade. You know, now he's very happy, and he loves his wife, you know. I mean, so why not make your significant other, you know, and yourself happy?
All right. We do have questions. Please be patient. There's someone who's been waiting a very good cellulite question, but let's stick with ED because there are more questions and we'll stay on topic here. So this one gets a little bit specific. What, if you can answer it, what is the depth and diameter of the procedure for erectile on men and women in centimeters or millimeters? If you can answer that.
Well, probably, I mean, the depth of penetration is, you know, I would estimate maybe 3 millimeters to 2 millimeters in to the tissue. You know, the depth of skin, we do a treatment with ultrasound. The depth is about 1.5 millimeters consistently. So this does penetrate into the corpus spongiosum, so estimated maybe 2 millimeters, 2 and 2.
You're going deeper than, I mean, you're getting that shockwave therapy.
Yeah.
It's traveling. And you think of those radial waves. I mean, The closer you are to that treatment tip, that's where you're probably going to have the most energy. As you start to spread out to the sides, that energy is going to disperse some, but you know, you can get some deeper penetration with that also.
There have been some questions here about sort of, I guess people are trying to visualize how they would perform that procedure. So here's one on that. Here for ED, are you treating around the root or the root and the shaft? And somebody else asked, where can we see, you know, a treatment for? I'm sorry, I want to interject here. We did do a webinar with Zimmer MedizinSystems regarding solely ED, and there was a treatment video, so you can actually see how that treatment is performed if you look into past webinars from Zimmer MedizinSystems. But I'm sorry, back to you. Are you treating the root or the root and the shaft?
So we treat both the root and the shaft. So to somewhat describe it, so we will have the patient obviously, you know, on the exam table with their thigh laterally placed, and therefore we can actually treat in that inguinal area laterally and slightly, and the protocols have changed, but a little bit posterior to the testicles. And then again, the shaft is treated you know, just basically the entrance of the vessels superiorly into the shaft of the penis. I do not treat dorsally, you know, over the artery very much, but lateral and in the entrance area. But we, you know, if anybody's interested, I mean, we could always, you know, have them come here, or we could, you know, find treatment videos that we could share.
Okay, and I just got a note from a representative of Zimmer MedizinSystems as you were speaking, and going back to the previous question, the depth of penetration is over 4 centimeters. So there you go.
Oh, wow.
Okay. All right. Let's talk about the female sexual medicine procedure. What is the protocol for your female procedure?
So it's more treatment externally. I don't know whether anybody's actually treated even with radiofrequency heat. But again, we treat the labia, and we can actually, you know, increase blood flow in the labia and clitoral area and in the entrance to the vaginal tissue.
Mm-hmm. Okay, we have a ton of questions remaining here, and we are running short on time. We should be wrapping up pretty soon. If you don't mind, could you give me another 5-10 minutes and take a few more questions?
Sure.
Sure.
Okay, wonderful. Let's see here. Let's go to cool sculpting, Z-Wave post cool sculpting. Do you add an additional charge for adding the Z-Wave treatment post cool sculpting?
So we have not added increased cost. Certainly, you certainly can. We obviously we want the best results for our patients, best outcome. And we just found that there was such a significant difference post cool sculpting with that aggressive massage with the Zimmer. We just sort of bundle it into the cost of cool sculpting.
And
Yeah,
someone,
every
go
practice,
ahead.
you got to think about that when you're doing as an adjunct to a surgical procedure, non-surgical procedure, not, you know, complication like a capsular contracture. You got to have some sense of where you're going practice-wise. Is it worth charging the patient more when they're potentially having a problem, or you can enhance an outcome? I mean, what's it worth to the practice from a final standpoint? Do you want, you know, a 1-star Google review that the patient was unhappy with your practice, or a 5-star Google review that you went a little bit further added this new treatment that the patient talks about and is happy. And you know, there's a lot of other variables you have to factor in besides what money you're making from it.
Okay, and besides, what differences besides efficacy do you notice when treating post-cool sculpting, like, for example, differences in side effects like numbness, bruising, soreness?
So significant decrease in numbness, decrease in soreness, and you know, again, you know, just to expedite it, the swelling goes down much quicker. I mean, I don't know if anybody, you know, I mean, I had cool sculpting, and I was really very puffy after that. I just had my, you know, my sort of flanks treated, and you know, our patients after the Zimmer, I mean, it's significant less edema. There's no way that manual manipulation of edema like that is equivalent to the Zimmer.
Yeah, and that's reproducible time after time after time, the improvement in results as well as reduced side effects. So what kind of feedback have you gotten from both patients and technicians about administering cool sculpting with Z-Wave afterward compared to hand massage?
So much more comfortable. It's less hand fatigue for the provider.
Mm-hmm.
You know, it's aggressive. You know, I don't know if any of you had to do the manipulation, but yeah, it's aggressive. And honestly, when you have a medical device, it's just so much professional looking, you know,
Mm-hmm.
instead of, you know, getting in there and, you know, massaging away.
Yeah.
You have this, you know, clean, sleek tool that, you know, does so much more. And the patients love it, you know, and it's less, there's less discomfort because there's vibration with the Zimmer. So you're vibrating and you're inducing the sound wave into the tissue, and instead of that, you know, painful hand massage.
So have your patients given you feedback about how it feels for them, or?
Oh, much more comfortable. Oh yeah,
Okay.
I mean, consistently.
All right, let's jump over to Cellulite and just a few more questions because you've been very, very generous with your time and we're already running over. So just a few more if you don't mind. So very interesting question. I promised we'd get back to this on Cellulite. Does the Z-Wave address all five types or stages of cellulite reduction, and how long for each treatment type? So stage 1, stage 2, stage 3 cellulite, is it effective for all?
I think it's effective for all. I mean, obviously, you know, severe, you know, cellulite. I mean, it may take more treatments, but you know, the effectiveness is there. So, I mean, I would recommend it for any patient with
So
any.
does that change your treatment protocol, stage 1 versus, say, stage 3? Would you go for 25 minutes instead of 20 minutes per session, or 3 times a week versus 2 times a week?
Right. I would probably not increase the time frame of, you know, I would stay with probably the 20-minute session, but I would definitely have them come in more frequently and
Okay.
for a longer series.
Okay, great. So are there any other technologies besides the ones we mentioned here that you've heard of but aren't offering that you think Z-Wave could make more efficacious?
If I can't think of it now, I'll find one.
Sure. We'll get back to the person who asked that. Okay, one more good cellulite question. How do Z-Wave treatments alone or Z-Wave in combination with other treatments compare with other technologies that you've used for cellulite?
So we've obviously went through the whole injectables for cellulite. We have done injectables followed with Zimmer. And I'm not impressed with any of our other cellulite treatments or any of those treatments that are out there. I've seen patients that have had other type of laser type treatments, and the scarring that they have come to us to reevaluate and hopefully try to correct. It's very difficult to correct scarring that's occurred. So again, that's why, you know, the Zimmer is such an effective tool, because it doesn't harm anybody, and there's really no end to the treatment. You could Zimmer constantly, you know, to achieve more effectiveness time and time again. So you know, that's my experience with Cellulite. Again, Dr. B talked about the old Stort's Cellupulse machine. You know, it was effective, not as effective as Zimmer, but it was incredibly uncomfortable and painful and very noisy. And the Zimmer company has just taken it to the top, where it's comfortable, it's quick, it's effective, and you know, I can't say anything else that we do in medicine is without side effects, but Zimmer certainly is.
Well, that says it all in a nutshell. Great way to close. Thank you so much, both of you, Dr. Anna Buinewicz and Dr. Brian Buinewicz, for your presentation earlier and for sticking with us for some Q&A.
Thank you.
Thank you.
Thank you. We really appreciate your time.
Sure.
And I'm just going to share one more slide here. Give me just one moment. If anyone would like more information about Z-Wave, Z-Wave Pro, and Z-Wave Q, please visit Zimmer MedizinSystems website at www.zimmerusa.com. Also visit the shopping site at shop.zimmerusa.com to view Z-Wave waiting room materials. If you have any questions, please send an email to info@zimmerusa.com. And this concludes today's webinar. Thank you very much for attending. A recorded version of this webinar will be emailed to all attendees so that you may review any of this information at your convenience. Good night.